A major Harvard-led study published in the Journal of American Medical Association found that the bright light exposure at night increases the risk of coronary artery disease, heart attack, heart failure, atrial fibrillation, and stroke. The list goes on. So we talked with Dr. John Puma, author of the upcoming book, The Indoor Epidemic, about all the effects of nighttime light. Doctor, I am so excited to talk to you because there was a lot of new information coming out of Harvard connecting exposure to artificial light at night with cardiovascular disease.
Right.
Tell me more.
Yeah, Teresa, as you know, in October, JAMA published a study that was actually international, but had Harvard researchers as part of it, that looked at millions of hours of nighttime exposure, of light exposure, over hundreds of thousands of people, and found that nighttime light from screens, from street lights, from monitors outside, between midnight and 6 a.m., dramatically raised the risk for heart disease, particularly heart attack, heart failure, atrial fibrillation.
This is so scary, Dr. Puma, and I feel like as a woman, all I do is worry about breast cancer because there's some availability bias, right? A lot of celebrities will be open about it. My mother and grandfather had it, when the facts are that a woman is more likely to die of heart disease.
You're exactly right, Teresa. And this is something that is easily preventable by having bright days, but dark nights. You know, most people don't know that the heart actually, like other organs, but especially the heart, because that's what we're talking about today, is run on a clock. Our organs have clocks. And if it gets the wrong signal at night, if the heart thinks it's daytime at night between midnight and 6 a.m., it increases inflammation, it increases blood pressure over the next 24 hours, and it causes a thicker blood, more blood clotting, thromboembolism even. And that's worrisome and actually problematic for the heart and for anybody worried about heart attack, stroke, atrial fibrillation.
You think this is such a serious problem that you've actually written a book about it. It's called Indoor Epidemic. There is an epidemic of all of us being on our screens, and you said from midnight to 6. By the way, everyone should read this book. You can pre-order it now, Indoor Epidemic by Dr. Puma. It's on Amazon because I want to know what to do. I think the fixes aren't as hard as we may think. So what can we be doing in our household after midnight or before?
Well, one interesting thing we can do is work in the morning to defeat this by getting bright sunlight for 15 minutes in the morning between an hour and 90 minutes of when we wake up. And that tells your circadian rhythm, your internal clock, as well as the different organ clocks, that it's morning. And that you get a cortisol response, and it helps you wake up. It actually helps your coffee work better in the morning. And it prepares you for making melatonin, Teresa, at night. And melatonin is the hormone in your brain that tells you that you're sleepy. If you have bright screens and bright lights and monitors and blues and whites at night, it still thinks it's daytime. It still thinks it's cortisol time. It doesn't help you make melatonin. It doesn't help you sleep. It doesn't reduce inflammation at night. It doesn't lower your blood pressure, which is normal to lower at night, or your temperature. And it screws up your circadian rhythm, your clock. So the first thing to do is to treat morning right. Get out, get 10 or 15 minutes, do something in your garden, walk down the street, get some exposure to tell your brain that you're going to be sleeping that night and you're waking up in the morning. That's the first thing.
Well, you call it free medicine, and I think that's so interesting because if the positive impacts of this 10 to 15 minutes of morning light could be, quantified and turned into a pill, everyone would want to take it because of how many positive health effects it would have. But no one's selling it. So it's hard to get people just, okay, get up 15 minutes earlier, walk your dog, have your coffee outside on your patio, and get those photons into your eyeballs.
That's right. That's right. Well, I mean, that's the beauty of understanding a little bit more about nature. about how we're so really well connected to nature, but we often take it for granted or don't understand it as a health prolonging, longevity giving tool. But actually understanding how to use nature, that morning light I talked about, how to meet people when you're outside. People think that nature is like the Grand Canyon or the Pacific Ocean, and that's nice. But nature is just walking down the street to a park and meeting somebody you know or meeting a new friend. That social part of nature is very important. But for nighttime risk for heart attacks, the easiest thing to do is to make your sleep environment dark and cool. Turn off those monitors. Put towels in front of them if you have to. Make the sleeping environment cool, and that will tell your brain that it's okay to go to sleep, and you'll cut your risk for heart disease from bright lights by half. That bright light problem is probably just as important as a bad diet, as smoking, as being sedentary, but we haven't known about it until recently.
Gosh, doctor, first it was smoking, then sitting was the new smoking. Now
That's
being
right.
indoors is the new smoking.
You got it. Boy, you have a terrific PR mind. I love that.
Thank you so much, doctor. I really learned a lot. Dr. Puma, his
You're
book,
welcome, Teresa.
Indoor Epidemic, pre-order it now. Thank you so much.
Pleasure. Thank you again.